the second form of combo birth control, which is very much like the pill in how it works, it just you use it differently, is the patch. So the patch is like a square Band-Aid that you put on your body. So a lot of people put it on their shoulder. Some people put it like on their torso, or you can put it on your bottom. It basically is like a Band-Aid that delivers the same medicine that's in the pill. So most people use the patch by wearing a patch and then taking it off at the end of the week, and then putting on a new patch and then taking it off at the end of the week, and then putting on a third patch, taking it off at the end of the week, and then having a week of no patch. In that no patch week, you're typically going to bleed kind of like a period. It isn't the same as a period because you probably didn't release an egg if the patch is working properly, because that's how it works. It prevents ovulation, so it prevents the release of an egg. But you still bleed like you're having a period. And that bleeding is because you're withdrawing or not adding hormones to your body for that particular week. Some people do just keep going. They wear a patch 4 weeks and then 4 weeks and then 4 weeks, and they don't take that week off. If you're doing that, it isn't to be extra careful about pregnancy. It's because you don't want to have that period-like bleeding. So that's a choice that you can make with your provider, but it's typically you're doing that for the bleeding side effects, or the lack of bleeding side effects. The risks of the patch are pretty much the same as the pill. So you have a higher chance of having a blood clot. You might not be a good candidate for the patch if you already are at high risk for blood clot for some reason. The additional risk of the patch is some people have a skin irritation, like they have a little allergic reaction where they actually put the patch. That's pretty uncommon. If that were to happen every time you wore it, it might not be the best method for you, but it's typically a pretty well-tolerated method for most people. The side effects of the patch are kind of similar to the side effects of pregnancy when people do have them, so possibly nausea, breast tenderness, a little bit of irregular bleeding. That's because the same hormones in the patch are kind of like the hormones of early pregnancy. When the patch is used perfectly, it's over 99% effective. However, in real life, it's more like 93% effective. Because if you change the day that you're supposed to switch out your patch by a day or two, or you forget to put a new one on after this 4-week cycle, that can really affect how well it works.